Mr. President, I rise on a matter of personal and collective privilege to raise a public health issue that has permeated to the Philippines for a long time. One of the rabies victims, her name was Jamaica, and her loved ones joined us in yesterday's session. She succumbed to rabies 2 months after she was bitten by a stray dog as she was walking home from school. Jamaica was not able to receive immediate medical attention as she regrettably kept the accident to herself. Mr. President, in her last days, Jamaica was able to document her heartbreaking condition as she was trying to be brave throughout the whole ordeal. Mr. President, rabies virtually has a 100% fatality rate once symptoms appear. An average of 300 to 400 Filipinos die of rabies each year, while around 4 million annual bite cases are recorded annually. These numbers place the Philippines sixth among the countries with the highest incident of rabies. Mr. President, isa po si Jamaica sa libo-libong kabataan na naging biktima ng rabies. Isa siya sa mga 300 to 400 na Pilipinong namamatay taon-taon mula sa infection na ito. Mr. President, Jamaica is not just a statistic. She is a representation of an important public health issue. Sa katauhan ng batang si Jamaica, makikita po natin ang kahalagahan ng pagkakaroon ng accessible at sapat na tulong medikal para sa mga viral infection tulad ng rabies. This March, as we observe Rabies Awareness Month, I hope to be a voice for this cause because behind campaigns like this is a haunting and silent reality for families like that of Jamaicans who suffered from the grim impact of this viral disease. Awareness alone is not enough. We must pursue concrete and sustained solutions to completely prevent rabies. The Animal Bite Treatment Center at San Lazaro Hospital, the National Referral Hospital for Infectious Diseases and Tropical Medicine in the Philippines, and the same hospital where doctors desperately try to save Jamaica, has seen a daily increase in consultations from 800 per day to 3,000, putting significant strain on the workforce and vaccine supplies. For the last 5 years, we saw a continuous rise of rabies-related deaths. From 235 cases in 2020, this ballooned to around 300 last year. In 2025, about 95% of these cases involve animals that are either unvaccinated or have an unknown vaccination status. With recent reports from DOH reflected a 65 While recent reports from the DOH reflected a 65% decrease in rabies cases from January to February 2026, compared to the same period last year, we should not be complacent. While this is a promising indicator of progress, we should complement it with decisive and tangible response. In 2025, the President directed several national and local government hospitals as well as health centers to provide free anti-rabies and anti-bite vaccinations. PhilHealth has also increased its animal bite treatment package to 5,850 pesos from the previous 3,000 pesos to cover essential post-exposure prophylaxis. This package includes rabies vaccine, rabies immune globulin for immediate protection, local wound care, tetanus toxoid and anti-tetanus serum, antibiotics, and necessary medical supplies such as syringes, alcohol, and antiseptics. Mr. President, I would also like to take this privileged hour to reiterate bills that I have filed in Congress that seek to address the interrelated issues and challenges we face concerning animals. We must merge the current governmental efforts with legislative actions that institutionalize our campaign against rabies and a holistic approach towards animal care in general. First, Senate Bill number 255, or the Animal Medical Center Act. If we are truly to promote animal welfare and prevent viral diseases such as rabies, we must ensure greater access to affordable veterinary services. Currently, veterinary clinics remain scarce and are often privately owned, making them inaccessible and unaffordable to many Filipinos. As such, this bill addresses the challenge of limited access to quality veterinary healthcare services across various regions of the country by establishing veterinary clinics in every city or municipality. This would ensure that farmers, pet owners, and communities have reliable access to veterinary healthcare services. Second, we have Senate Bill number 591, or the act promoting the adoption of stray and impounded animals by providing incentives. Mr. President, there are 13.11 million stray cats and dogs in our country. Many of these animals are potential carriers of rabies and other diseases that may pose serious risks to human health. These animals are also those who are struggling to survive on the streets, with hundreds of them being euthanized monthly due to lack of space and resources. As such, this bill aims to encourage the adoption of stray and impounded animals through incentives. On a personal note, we have adopted animals from the Potion Project, and we continue to take care of a lot of these stray animals in our own home. Yung iba nasagasaan ng kotse, yung iba ay nabandon ng mga owners. So that's that's one of the things that we enjoy doing, is adopting stray animals, dogs in particular. Many Filipinos consider their pets as members of their family. Some even proudly call themselves fur parents, celebrating their pet's birthday, caring for them with love, and mourning their loss, as they would any loved one. However, not all these animals experience this kind of compassion. While some live comfortably and receive proper care, others endure cruelty, neglect, abandonment. And that's why, Mr. President, we call for reinforced laws and stricter enforcement to elevate our standards for animal welfare. Mr. President, these proposed measures, together with the current efforts of the government, may provide a holistic approach towards addressing the issue of animal welfare and animal-related diseases such as rabies. Yes, rabies has a 100% fatality rate, but it is also 100% preventable. Vaccinating our pets remains our first line of defense, and it is the responsibility of the government to ensure that these are accessible, affordable, and available to every community. At the same time, pet owners share this responsibility by ensuring that their animals are properly vaccinated. In cases of exposure, immediate medical treatment after a bite or scratch can mean the difference between life or death. Preventing rabies, therefore, is not only a matter of policy. It is a shared responsibility between the government, communities, and every pet owner committed to both human and animal lives. In fact, as part of our continuing efforts to combat the spread of rabies, there will be a spay and neuter event spearheaded by the Philippine Veterinary Medical Association in partnership with the Provincial, City, and Municipal Veterinarians League of the Philippines on March 19, 2026. This is a simultaneous nationwide activity to be participated in by at least 19 localities, including a primary event at the Provincial Veterinary Office in Malolos, Bulacan. This event will be held in line with the Rabies Awareness Month and aims to highlight the vital role of animal welfare, responsible pet ownership, and mass spay and neuter initiatives in the effective control and eventual eradication of rabies. Mr. President, dear colleagues, ilang kabataan na tulad ni Jamaica pa ang babawian ng buhay dahil walang sapat na access sa agarang lunas, praktikal na kaalaman at serbisyong beterinaryo. Kung ang asong nakakagat kay Jamaica ay nabakunahan lamang, marahil ay buhay po siya ngayon. It is high time that we translate our shared commitment into concrete action, measures that will strengthen animal welfare, enhance public health protection, and ultimately prevent the loss of both human and animal lives. This is a step closer to better communal responsibility and in advancing universal humanity. By adopting conclusive policies coupled with consistent implementation, we hope to set an example to the future generations on responsible and compassionate pet ownership and purposeful, decisive governmental action reflecting a society that is pragmatic but inclusive and empathetic, even to our animal friends and family members.